Sumithrayo warmly welcomes all of you here today, which is World Mental Health Day, overseen by the World Federation for Mental Health, as a day to focus on all aspects of mental health. This year's theme is Mental Health in an Unequal World. The Federation highlights that between 75% and 95% of people in low and middle income countries are unable to access mental health services, while there are inequalities of access in high income countries as well. World Mental Health Day is an excellent opportunity to press decision makers to discuss and take positive action to increase the quality and provision of mental health. So let's all join hands to make this happen. We also warmly welcome our guest speaker, Professor Shehan Williams, who is the Professor of Psychiatry in the Faculty of Medicine at the University of California. His topic today is a very relevant one, the psychological fallout of COVID-19. This is the second in the series of 4 webinars organized by Sumithrayo during the month of October to support World Mental Health Day. A quick review about Sumithrayo, which was founded 47 years ago and was the first suicide prevention crisis center in Sri Lanka. At Sumithrayo, barriers such as class, race, and religion, political or sexual leanings are non-existent. Every caller will be provided with emotional support in an atmosphere of total confidentiality. The service provided is completely free, devoted to responding to people in crisis and preventing suicide, focusing on empathetic, active listening and non-judgmental responses. Sumithrayo volunteers endeavor to take every person in crisis seriously. The goal of their befriending is to empower the caller to make life-enhancing choices. Our mission is to help people choose to live and not choose to die. The center is open 365 days of the year. Presently, due to the situation in the country, we are only able to take telephone calls and answer emails. Please feel free to ask questions by clicking the Q&A tool at the bottom of your screen. All questions will be answered after Prof. Williams completes his presentation. Also note that Professor Williams will be summarizing in Tamil at the end of the Q&A. So those interested in listening, please do not leave the webinar. So Professor Williams, I have an interesting question to start the proceedings. Can you hear me, Professor Williams?
Yes, Mr. Duman, thank you very much for inviting me. I'm honored to be a part of this panel and to be present this evening.
Thank you. So, Professor Williams, many have experienced mental health issues or behavioral health challenges during the past year. Tell us, what is the link between mental health and COVID-19?
Right. Thank you. So I will just take you through a few slides to just emphasize on a few aspects that sort of point us in the direction of what you're asking at this point. Can you see my slide?
Of course we can, Professor. Thank you.
Right. Just give me a moment.
Sure.
Right. So what's the link between COVID-19 and mental health? So as you know, prior to Corona, we were all very much caught up in this rat race. Running this race, trying to achieve various things, running to school with our children, running to achieve various things in our careers. And we had many plans and ambitions. But this little virus came along and suddenly, out of the blue, put a stop to many of these plans and endeavors that we were undertaking. Now, in this rat race, we were also wearing many hats. We had many stressors related to professions, our families, our parents, our children, and so on and so forth. And suddenly this COVID-19 struck and we were taken into lockdown, and it gave us some time, nevertheless, initially, to relax a little bit, take things a little easy, perhaps step out of this rat race, do some reading, gardening, and spring cleaning. But as time went on, we realized the effects of isolation, of social distancing, of not being able to do many of the things we took for granted in terms of meeting with people. Almost all our plans were disrupted, and we had to face this grim reality of uncertainty, which is perhaps the only reality in life. So this brought a lot of anxiety, fear, not just of getting this illness, but also sleep issues. And we know many people all over the world had depression. If you look at the facts and figures, it's not just the COVID illness per se and the physical consequences, but the last year we have seen an increase in millions of people with depression and anxiety, anywhere between 25 to 50% from the baseline. So with this, the consequent challenges of loss of employment, businesses, finances, having to do perhaps with too much time on our hands, and interpersonal conflict sometimes with our children who are not going to school now but were cooped up in their rooms. We also saw the effects of boredom and the rush to the places that sold alcohol as soon as there was some respite, or when the shutters were pulled up again and people were allowed to get alcohol, telling us how people responded. However, the COVID has its positives. It's a time where we need to think about the healthy lifestyle that we need to lead amidst the rat race. It has physical, emotional, moral, and spiritual aspects which we often neglect. Regular physical exercise, healthy eating habits, avoiding alcohol or smoking. We all need, for our psychological well-being, relaxation, rest, leisure. Those of us who didn't have hobbies, interests, and connections with our family had time to perhaps cultivate them or to rethink our lives and to think of the uncertainty around us and to think of the personal development that all of us need to work on to face the myriad challenges that we come across, or the challenges all the time. And living with fellow men in tolerance and being resilient despite the stresses that we may encounter. So we have to learn to live with uncertainty, take a day at a time, realize that we cannot control everything, and also sometimes focus on our mental health and need to talk to somebody about it and not feel ashamed that we can be vulnerable in the most difficult of circumstances. So I will just recap this in Sinhala. ජීවිතේ අපි ඉංග්‍රීසි වලින් කියනවා rat race එකක් කියලා. අපි සමහර විට එක එක දේවල් පිටිපස්සේ ජීවිතේ අපි දුවනවා. අපිට වෙලාවක් නැහැ. ඔහේ දුවනවා. අපිට ඉස්සරහා යන මීයා දුවන නිසා. අපි දන්නෙත් නැහැ ඒ දුවන්නේ කියලා. නමුත් දුවන්න ගත්තට නැවතින්නත් බෑ. හදිසියෙ නැවතුනනම් නම් පිටිපස්සේ ඉන්න මීයන් ටික අපි උඩ නැගලා අපිව පාගල චොප්ප කරලා දායි. එයින් අපි දුවන්නම වෙනවා. නමුත් මේ කොවිඩ් ආපු එකෙන් අපිට යම් කිසි මොහොතක් හැමෝම හිටිලා අපි අපි කොහෙද මේ දුවන්නේ කියලා හිතන්න වෙලා තියෙනවා. අපි ගොඩක් තොප්පි දාගෙන දුවනවා. අපි ගොඩක් දේවල් අපේ ජීවිතයේ දාගෙන ස්ට්‍රෙස් වෙලා තියෙනවා. නමුත් කොරෝනා මුලදී ආපුවම අපි ඔක්කොටම මොහොතක් හම්බුණා. පොඩ්ඩක් අපේ ජීවිතයේ අපි කරපු නැති දේවල් කරන්න, සින්දුවක් අහන්න, මොන හරි දෙයක් පොතක් කියවන්න, අපේ වත්තේ හරි අපේ තියෙන මල් ටික බලලා යම්කිසි සතුටක් මුලදී ලබා ගන්න. නමුත් කාලේ යනකොට අපිට තේරුණා මෙතන අපි තනි වුණා, සමාජයෙන් ගොඩක් ඈත් වුණා, අපේ ගොඩක් තියෙන බලාපොරොත්තු දැන් කොයි පැත්තට යයිද කියලා අපි පොඩ්ඩක් කලබල වුණා. අපිට ගොඩක් දෙනෙකුට බයක් ආවා අපිට කොරෝනා හැදෙයිද කියලා. අපි එක එක්කෙනාගෙන් අපි ඈත් වුණා. සමහර විට අපිට නිින්ද යන්න අමාරුවක් ආවා. ડિප්‍රෙෂන්, ඇන්සයිටි අපේ ස්ටැටිස්ටික්ස් වලින් අපි දැනගන්න පුළුවන්. විෂාදයේ තත්ත්වයේ ආතතියේ ගොඩක් වැඩි වුණා ලෝකේ. ගිය අවුරුද්දේ අපිට 100ට සාමාන්‍යයට වඩා 25ක් හෝ 50ක් ප්‍රමාණයකට මේ තත්ත්වයේ ජනගහනය තුල වැඩි වුණා. අපි බලනකොට ගොඩක් අයගේ රස්සාවල් නැති වුණා, බිස්නසස් වැටුණා, ආර්ථික ගැටලු ඇති වුණා. ගෙවල් ඇතුලේ ගොඩක් සමහර විට කචල් ඇති වුණා, ළමයි එක්ක, බිරිඳ එක්ක ගොඩක් දුසිත දේවල් සමහර විට වුණා ගෙදරවල ඉන්නකොට. සමහර අය විශේෂයෙන්ම අරක්කු වලට පිටිපස්සේ දිව්වා ඒගොල්ලන්ගේ පාලුකම නැති කරගන්න. නමුත් අපි හැමෝම මේ ලෝකේ ජීවත් වෙන කාලේ අපි සුවදව හොඳ තත්ත්වයක ජීවත් වෙන්න ඕනේ. ඒකට කායික පමණක් නෙමෙයි අපේ මානසික, ආගමික හැම පැත්තෙම සෞඛ්‍ය ගැන අපි හිතන්න ඕනේ. අපි එක්සර්සයිස් කරන්න ඕනේ, හරියට කෑම කන්න ඕනේ, මත්පැන් වලින් වළකිලා ජීවත් වෙන්න ඕනේ. අපේ මානසික තත්ත්වය ගැන අපි කොච්චර හිතන්න ඕනද කියන එක අපිට දැනුණා. අපිට විවේකයක් අනිවාර්යෙන් ජීවිතේ ඕනේ. අපිට යම් දේවල් අපේ පවුල් එක්ක වෙලා ගත කරන එකකින් වැදගත්කම අපි දැනගන්න ඕනේ. ඊට අමතරව අපි තුල ඇති වෙන අපේ වර්ධනය, අපේ දියුණුව ගැන, අපේ මනස දියුණුව කරන්න, අනිත් අයව ගැන හිතලා ඒගොල්ලන් වෙනුවෙන් අපි ජීවත් වෙන්න, ඒගොල්ලන්ගේ විවිධාකාර අදහස් අපි පිළිගෙන අපි ඒගොල්ලන් සමග මේ ගමන යන්න. ඒ විතරක් නෙමේ, ප්‍රශ්නයක් එනකොට විවිධාකාර දේවල් වලට මුහුණ දෙන්න, අපේ ශක්තිය වැඩි කරගන්න මේක අවස්ථාවක් එනවා. දැනුත් මේ අවස්ථාව පැවතිගෙන යනවා. අපි දවසින් දවස මේ මොහොතේ ජීවත් වෙන්න අපි පුරුදු වෙන්න ඕනේ. අපි ලෝකේ හැමදේම අපි පාලනය කරන්න බෑ. පොඩි වෛරස් එකට පවා අපිව බිමට වටන්න පුළුවන් කියන එක අපිට තේරුණා. අපි මානසික සෞඛ්‍යය ගැන අපි නොසලකා ඉන්න බෑ. අපි සමහර විට හිත වැටෙනකොට යම් කෙනෙක් කතා කරන්න වෙනවා, උදව්වක් ගන්න වෙනවා කියන එක අපි දැනගන්න හේතුවක් ඇති වුණා. ස්තුතියි. Thank you.
Sorry. Thank you very much, Professor Williams, for that very informative presentation in answering that question. It was very down to earth too, so it's very easy to understand and come to terms. May I ask you another little question to move on? Is it all right?
Yes, certainly.
How would you? Okay. So, can people who have experienced tragic events like during the COVID-19 also experience something called post-traumatic growth, a positive psychological change that results in a higher level of personal functioning and well-being? Or in other words, how can we grow from this experience, Professor?
Yes, so that's a very interesting and useful question, I think. So we believe oftentimes that every cloud has a silver lining. And that's why even in my slides, I tried to focus on what I thought was relevant, in the sense of us realizing that COVID does bring a lot of doom and gloom. It's brought us down to earth, but it's also a time for us to reflect on what we are doing, the rat race that we have been running, and think of the important values, think of what really matters, and try to realign ourselves and live a holistic life. So it's certainly a time for growth, a growth that perhaps brings in a lot of resilience that I mentioned about. And I think, if you look back at some of the countries in the world that were most devastated by World War I and II, you would see that they have risen from the ashes. And it's that determination that sort of took them to the heights that they are in now. And the people, through these wars, had developed so much resilience. They were tragic events, no doubt, but for the survivors, it was also an opportunity to rebuild themselves. And I don't think a lot of people in some of these countries, the newer generation, realizes the trauma that people faced during the major wars and subsequently, and may not really have that impetus to grow their countries anymore. But definitely, many of the countries rose from the ashes, and people were much stronger, much resilient, much more hardworking, much more determined, and were people who thought about others and were not sort of inward-looking people who appreciated others' strengths and weaknesses and worked with them. And I think the modern concepts of human rights and equality that you're talking about, even through our theme today, I think is relevant in this realm of post-traumatic growth. සිංහලෙන් කෙටියෙන් කිව්වා නම් මම හිතන්නේ උඩුමාන ඇහුවේ අපි මේ ප්‍රශ්නවල තුල අපි post traumatic growth කියන්නේ අපි යම්කිසි දියුණුවක් පුද්ගලිකව අපි දකින්න පුළුවන්ද කියලා. මම කිව්වේ අනිවාර්යෙන් යම්කිසි දියුණුවක් අපි ඇති කර ගන්න ඕනේ. ලෝකයේ අපි සමහර විට ජීවත් වෙන විදියට ඔහේ ජීවත් වෙලා හරියන්නේ නැහැ. මේ අවස්ථාවක් අපිට හම්බ වෙලා තියෙනවා නැවත හිතලා බලන්න. ලෝකේ මොකද්ද වැදගත්කම තියෙන්නේ, අපේ ජීවිතේ වැදගත්කම මොකද්ද කියන එක. මම කිව්වා ලෝක යුද්ධයට පස්සේ ඒ රටවල් ගොඩාක්ම එෆෙක්ට් වුණ රටවල් තමයි ගොඩාක්ම ඉක්මනටම ඊට වඩා ලොකු තැනට දැන් අද ලෝකේ ඇවිල්ලා තියෙනවා. ඒකට ඒ කාලේ හිටපු ඒ කණ්ඩායම ඒ සර්වයිවර්ස්ලා කියන්නේ රටේ ඉතුරු වෙලා හිටපු කට්ටිය කොච්චර ඒ ට්‍රෝමා එකක් තිබුණත් අපි ඒ තුලින් ඒගොල්ලන් human rights මිනිසුන්ගේ rights ගැන අයිතිවාසිකම් ගැන ඒගොල්ලන් යම් කිසි දේවල් හදලා ඒකම රට වුණත් ඒගොල්ලන් දියුණු කරගත්තා. ඒ නිසා මේ අවස්ථාව තුල වුණත් අපි මේ තුලින් අපේ පුද්ගලික ජීවිතයේ අපේ families අපේ සමාජයේ අපි යම්කිසි growth එකක් අපි ඇති කරගන්න අනිවාර්යයෙන්ම උත්සාහ කරන්න යුතුයි.
Thank you very much, Professor Williams, for those very insightful comments on this question, and also for motivating us with your reference to how the world was so resilient after the world wars. Thank you very much. It was very interesting to listen to that comparison. I have another question, Professor, which is also, I think, very relevant to what's happening to all of us today. We may tend to pay more attention to what's going wrong rather than what's going right. This tendency can prevent us from noticing those people or practices that have been sustaining us during the pandemic. As a result, Professor, we might be overlooking our personal strengths, the power of our social network, or other sources of resilience, like you mentioned. Can you kindly comment, Professor?
Yes, certainly. I think, as I mentioned again, COVID-19 gave us a time for reflection to look back and look at the things that matter. Take time and listen to the birds, the music, talk to our family members, spend more time with our children, people close to us, and try or realize the importance of the social networks we have. For many of us, it was a time to also perhaps learn to live with fewer things, travel less, and enjoy the simple things in life. And I think these were but positive aspects, and people do think the environment would be thankful in the sense of less travel and all the sort of abuse the environment has been weathering during our sort of materialistic consumption of all that surrounds us. So it's a time to focus on other aspects of life, the things that really matter in terms of social interaction, because as human beings, we are primarily social beings. And that's what defines us. We are defined not by what we do or anything else, but the networks we have. Even as a doctor, if I don't have people to doctor, I am sort of not defined as a doctor. It's because of the role I play. And that role is determined by the people around me. So we are all defined by the people around us. And if we are not living in an island. And therefore, I think we realized that this was but physical distancing that COVID brought in, not really social distancing. But I find it intriguing that we have persisted with this word right along, rather than changing it to just physical distancing. Because with physical distancing comes social distancing as well, in one way or the other. The power of touch is lost. Standing close to somebody and relaying our emotions to them, mirroring their language and their body language. All these are important aspects of social communication that we have built up over centuries, and which sort of give us confidence in the person that we interact with, allow us to feel their genuineness, sincerity, and their warmth. And all these were challenged with this physical distancing and the wearing of masks. A smile that has been the highlight of human behavior for centuries. I think no animal in this world smiles, expresses emotions so wonderfully as human beings do with the smile. And that we had to cover during our interactions. And that has a profound effect on the social connections we make. So in that sense, although it was physical distancing, in reality, it was social distancing. But thanks to the fact that we had other social technology that enables us to interact with people. And I think even now we are lucky in many ways to be able to be seated in our homes. Some of us may be lounging in our chairs, others on our beds, listening to this rather than having to dress up and go and meet at a meeting place somewhere, if this mental health day program was done in that context. So it has enabled us to inform ourselves more, to connect sometimes perhaps even more than we would normally do if we were to connect at a physical level. So there are other positives of the whole aspects, but it's also been a challenge to all of us. So මං කෙටියෙන් කිව්වා නම් සිංහලෙන් මං හිතන්නේ අපේ ප්‍රශ්නය ඇවිල්ලා කොහොමද මේ සමාජ තුල මේ ප්‍රශ්නය ඇතුව අපි අපේ relationships අපි ගොඩනගා ගන්න පුළුවන් කියන එක දැන් ඇත්තටම මේ COVID නිසා අපි එක කෙනාගෙන් ඈත් වෙන්න වෙලා තියෙනවා. ඒක physical distancing කියලා තිබුණත් අපි ඒකෙන් යම් කිසි අපි එක එක්කෙනා මුණ ගැසලා හම්බ වෙන්න අවස්ථාවල් හම්බුණත් අපිට අපේ ලස්සන සිනාව අපි ළඟින් කතා කරලා ඒගොල්ලන්ට ඒ ආදරේ පෙන්වන්න අපිට බැරිකමක් තියෙනවා. නමුත් මේ නවීන ලෝකේ COVID ලෝකේ අපි Zoom තුල වෙන ටෙක්නොලොජි හරහා අපි කොහොම හරි අපේ සමාජ ශක්තිය අපේ සමාජ සීලිකම අපි ඉස්සරහට ගෙනියනවා.
Thank you, Professor Williams. That was excellent. And for myself, I thought I learned a lot from what you said just now, especially about how that mask can mask our emotions and how we could really come out of that with those positive messages that you gave us. And I also personally feel that the technology that we are left with today might be in the future too, even though COVID is not there anymore, this might be the also remain with us and to our advantage, of course. So that was an excellent answer that you gave us, and those insights were very, very important. I have another question, which is actually, it has a lot of impact on us today, and negative impact really, and it needs to be fine-tuned, and it really needs some kind of inputs from people like you, because misinformation, Professor, and disinformation can spread like a virus too, and cause what they call an infodemic. One person might share fake news with their friends and family, and then a handful of them share it with more of their friends and family. And therefore before you know it even, potentially harmful or dangerous information is taking over everyone's news feed. Professor, how can we navigate misinformation and disinformation and thereby reduce the distress it causes to all of us? Right. I know it's a complicated question, I'm sorry.
Yeah, but I must say that, this is something that also leads to this whole aspect of growth in the midst of Corona. And I think one of the most important learning aspects that I hope that even schools, I am a firm believer that it's time now in a modern world to rethink our whole education system. And I hope we will do that. But I know we are a long way off, because I think the primary thing is education is no more the learning of facts. Facts are out there, and there's so much out there. And, you know, when we were children, we had to get an encyclopedia and go and sit in this library and try to find various things. You know, today Google knows everything. It's just a Google step away. So acquiring knowledge and learning children to memorize, you know, who the kings were in this country, and, you know, who created this and that and other thing, and try to hold that knowledge in your brain is useless, because, you know, that knowledge may not even be relevant to the work that you eventually do. I sometimes feel sad that 90% of my time has been spent in my life acquiring so much knowledge that I am not able to use today, and which I have forgotten. So I think schools now should look at, and I feel sorry for parents also, because a lot of them are very worried about children not having been able to finish the syllabus. I think syllabus should be the least of anybody's concern, right? What is important, as Einstein said, is not education is not the learning of facts. It's the training of the mind to think. And one of the most important things is critical thinking. This new world, while we go ahead with technology and you say it's here to stay, and we have such information overload, we need to be tuned to pick out the right information, and also to be able to critically navigate this load of information we have. Otherwise, we'll be influenced by so many different vibes and persons trying to communicate different things to us. And we are all sort of swamped by this knowledge. And the most dangerous thing in this social media also is this thing where we communicate with like-minded people. So we are all sharing information. So you get messages. If you're part of a certain group, you get messages or you get all the information supporting that. I mean, I can give you so many examples. If you take, like, if I like bananas, I will like to, I would have a group of people who also like bananas and support, tell me all the reason why bananas are good for health. You Google, benefits of bananas. If you are belonging to a group that says, okay, bananas are horrible, they are the worst thing, you Google and there'll be another group, having enough information, say that eating bananas are bad for your health. Now, to be truthful, I really don't know the answer for this. And it's very difficult trying to really find out the answer. I would go by empirical knowledge. We have been eating bananas for a long time. I will not eat too much. I will maybe eat a little bit and go through, because I don't believe either sources of this information, because I have to again look at the source and how to predict. And unfortunately, even the so what we usually tend to believe is what is brought out by professionals or so-called experts. And unfortunately, experts also today mislead us most often. It's difficult to find the real expert because there are a lot of pseudo experts in this, in everything. So it's a real challenge. And so we have to make up our own mind on a lot of issues. But when you belong to certain group and you belong to this group that is telling you that eating plantains is bad or bananas is bad, then you feed into what's called that echo chamber. So you have more and more people who have your similar ideas congregating with you, and these thoughts are echoed in your brain. And then you go on this mission to destroy all the banana plantations because you believe bananas are bad for the whole earth, and you are convinced on this viewpoint. So it's very dangerous. A person who may just think that, okay, bananas are bad, I'll not even eat banana, now gets more stimulated and becomes militant, because there are other fellows who are feeding into this and saying, look, it's so bad, we should take some action and bring down all the banana plantations in this country. So this is the whole crux of the whole issue today in this world. And I find all these sort of different things and so many fights and, people sharing various messages about various things. There are Trump bashers and Trump supporters. So, both of them, there is no meeting point, and we are also either part of one group or the other. So I think the challenge for the young people in their education is to be able to think critically and to make the right decision, weighing up the facts that are before them, being able to decipher fact from fiction. And modern education will have to be all about this aspect and about developing and growing your brain to be able to handle the information overload around us. And I hope that COVID-19 would be a stimulus for us to rethink the whole education and our mindset and help us grow in that aspect. මං සිංහලෙන් කියන්නම් විශේෂයෙන්ම ආපු ප්‍රශ්නේ තමයි මේ ලෝකේ ඉන්ෆෝඩෙමික් කියන ගොඩාක් අපිට එක එක විස්තර එනවා, වැක්සින් හොඳයි කියනවා, වැක්සින් නරකයි කියනවා. හරි, ඒ වගේ එක එක දේවල් එනවා. මේ අතරතුර අපි කොහොමද මේ තීරණයක් ගන්න කියන. එතන තමයි අපේ এডুকেෂන් සිස්ටම් එකේ ලොකු වරද්දක් තියෙනවා. අපි දැනටත් බලාගෙන ඉන්නේ এডুকেෂන් කියන දේ යම් කිසි කරුණු ටිකක් එකතු කිරීම කියලා. දැනට කරුණු ටිකක් එකතු කරලා වැඩක් නැහැ. කරුණු අපිට මතක තියාගෙන ඔළුවේ උස්සගෙන ගිහිල්ලත් වැඩක් නැහැ. Google හැමදේම දන්නවා. කරුණු ටික අපි Google වලින් ඕන වෙලාවක ඕන එකක් ගන්න පුළුවන්. ලංකාවේ පළවෙනි රාජ්‍යරුවා කවුද? එයා හදපු දාගබ ටික මොකද්ද? වෙබ් ටික මොකද්ද? ඒවා ඔක්කොම ඔළුවේ මතක තියාගෙන යන්න ඕනේ නැහැ අපිට. ඒවා අවශ්‍යතා අනුව අපිට ටක් ගාලා ඒවා දැනගන්න පුළුවන් Google වල. නමුත් අපිට ඕනේ මේ වගේ ගොඩක් ඉන්ෆර්මේෂන් තියෙන එකේ ඇත්ත එක මොකද්ද බොරු එකක් වගේ. මේ දාගබ ඇත්තටම හදපු එක මේ දාගබ වෙන රාජ්‍යරුවා හදුවා කියලා කියන්න පුළුවන් බොරුවයි. ඇත්ත සෝස් එක මොකක්ද? දෙවෙනි දේ තමයි අපි යම් කිසි දෙයක් ගත්තාම ඒකට දෙපැත්තක් තියෙනවා. මම කිව්වා මේ අපි කෙසෙල් ගෙඩියක් ගත්තා නම් ඒකට කණ්ඩායම් දෙකක් තියෙනවා. එක කණ්ඩායම් Google කරලා බලුවා කියනවා කෙසෙල් ගෙඩිය හොඳ නැහැ. ඒක ලෙඩ හැදෙනවා ඒවා මේවා. තව කණ්ඩායමක ගිහලා ඒගොල්ලන් ඒ ගැන ගොඩක් දේවල් කරන කෙසෙල්ම ලෝකේ තියෙන හොඳම ගෙඩිය. ඒක කෑම නම් හොඳයි කියලා. ඉතින් අපි එකම දේම අපි අහනවා. ඊට පස්සේ එක කණ්ඩායමක් ඉතින් කෙසෙල් ගෙඩිය හොඳ නැහැ කියලා හිතනවා. ඔහෙ ඉතින් මොකා ඉන්න පුළුවන් එයාට. එහෙමත් නෙමෙයි. ඊට පස්සේ එයා අනිත් අයගේ මේ ඔක්කොම මෙසේජ් අරගෙන කණ්ඩායමක්පත් වෙනවා ලංකාවේ තියෙන කෙසල් ගෙඩි මේ කෙසල් වතු ටික ඔක්කොම නාස්ති කරලා දානවා. ඒ තරමට මිනිස්සු යනවා ඒගොල්ලන්ගේ එක අදහස් දිනු කරගෙන. ඒක අපි කියනවා එකෝ චේම්බර්ස් කියලා. ඒ වගේ දෙයක් වෙනවා. ඉතින් මේවා වලින් අපි වැළකීලා අපි මේ ගමන යන්න අපිට හොඳ අපේ බ්‍රේන් එක අපි හිතන විදිය අපි දිනු කරගන්න ඕනේ. අලුත් එඩියුකේෂන් කියන එක අපේ අපි ඉගෙන ගන්න දේවල් වලින් ඉස්කෝලවල අපේ අපිට දැනගන්න ඕන අපිට වැදගත්ම දේ තමයි කොහොමද හරියට ෆැක්ට්ස් ටික අරගෙන ඒක සමබර කළා මේකේ ඇත්ත මොකද්ද බොරු මොකද්ද කියන එක අමාරුවෙන්වත් දැනගෙන ඉස්සරහට යන්න අපේ බ්‍රේන් එක දියුණු කරන එක. ඒවැනි අධ්‍යාපන ක්‍රමයේ තමයි ඉස්සරහට ලංකාවට හෝ ලෝකයට වැදගත් වෙන්නේ. ස්තුතියි.
Thank you very much, Professor. I must say that the manner in which you explain things is so very simple to understand and absorb. And I'm sure everybody listening in today will endorse what I say. Also, I fully agree with you that, and I'm sure all will too, that the education system has to be restructured with the kind of knowledge that is available on Google and, where you don't need to memorize stuff. Doctor, there is a interesting comment on the chat, which I would like you to comment on. The person refers to you, Doctor, because of the mask, now we have learned to smile with our eyes and eye contact has risen up. What would you like to say about that?
Yeah, I think that's a very good observation and I would commend you on that. I think all of us are trying to smile with our eyes, but it's not easy. It's going to take us years and generations to master it, I suppose. Whether eyes can take the place of the beautiful teeth that we have, I'm not sure. But I think that's what we have to do. But whether it's the real substitute, I don't know. Maybe 100 years from now, we may lose the function of our teeth and the mouth to smile and develop something in our eyes. I hope it's not too much of an eye strain when it comes to that.
Thanks, Doctor. But would you mind saying that in Sinhalese too?
Oh, යම් කිසි ප්‍රශ්නේ තමයි මේ අපි දැන් මාස්ක් එක දාගෙන ඉන්නලා අපි ඇස් වලින් hina වෙන්න අපි ඉගෙන ගන්නවා කියන එක. හොඳ දෙයක් තමයි, ලේසි දෙයක් නෙමෙයි. නමුත් ඒ වෙනි දෙයක් අපි දිනු කරගන්න අපිට මං හිතන්නේ වසර ගණන් අපි බලන් ඉන්න වෙනවා. ඉතින් ඒ වගේ තත්වයක් එනකොට මං හිතන්නේ අපේ තත් වලින් නෙමෙයි අපේ ඇස් වලින් hina වෙන්න අපේ මූණවල් වෙනස් වෙන්න වෙයි. ඒ වෙනි තත්වයක් අපිට ඒ වෙයිද කියන එක තමයි ලොකු දෙයක්. ඒක හොඳ දෙයක්ද නරක දෙයක්ද මන් දන්නේ නැහැ.
Thanks, Professor. There's somebody who is already complimenting you on that answer and perfectly explained. Eyes can show thousands of emotions. So, I mean, that's something that we can really think about developing, that fact that it's about this eye contact. I haven't heard this thing before, and it's very, very interesting to me now that you can really show a lot of emotion with your eyes and your facial expressions above your mouth, your forehead, your eyebrows, your nose, your cheeks, especially. So it's interesting. And another question, Professor, on the chat is, for those who have lost a loved one to COVID and due to quarantine could not be with them during their last moments, what advice would you provide to their families to overcome their grief?
Yeah, that's a very sort of
deep question. Yes,
deep question. Yeah, see, grief is a very complex response, and I think we cannot in a sense advise anybody as to what they can do, because it's a very personal thing and you have to grieve the loss in your own way. It's a very difficult situation, as you know, in normal times. I mean, grief is a universal experience that all of us will experience at some point in our lives, but it's more pronounced when it's a loved one who has passed away without you being able to be close to them or not knowing what happened to them in their last moments. nor being able to grieve properly by, having the person even after they are dead, giving them a proper funeral and grieving with friends and families and remembering and doing some memorialization of the person you loved. So I think even if they were unable to grieve in terms of the normal rituals we do, I think they should be supported to still grieve, where family and friends need to socially connect with them, even if not physically, and be sure that they support them emotionally and let them know that you're there for them. And they need to make some effort to conduct the religious ceremonies or do what they would like to do to their beloved loved ones who passed away in whatever way they can, where they can perhaps do things in their honor. Make sure that they are allowed to grieve for them, maybe to have a grave if that is what they would like to have, and have some way of celebrating the life of the person they have lost, because that will help them to come over the immense grief they must be facing because of the sudden loss. මම සිංහලෙන් කිව්වා නම් ඒ ප්‍රශ්නේ තමයි යම් කිසි කෙනෙක් අපි කොවිඩ් නිසා අපෙන් එයා ඉවත් වෙලා ගියා නම් යා මරණයක් දෙයක් වගේ දෙයක් වුණා නම් ඒ ෆැමිලි මෙම්බර් කෙනෙකුට අපි මොන විදියටද යම් කිසි උදව්වක් කරන්න පුළුවන් කියන එක මරණය කියන එක ඒ වගේ අවස්ථාවකදී අපි හැමෝටම හරි දුක් සිත වෙන දෙයක්. ඒ අවස්ථාවකදී අපි සාමාන්‍ය විදියට අපේ ඒ ෆියුනරල් එක තියන්න බැරි වෙනවා. ඒ කෙනා ළඟ අපිට ඉන්න බැරි වුණා. යා ඒ අන්තිම මොහොතේදී අපිට යම් කිසි දෙයක් කරන්න බැරි වුණා කියන ඒ දුක ඒ ළඟින් ඉන්න නැතිෙක්ට ඇති වෙන්න පුළුවන්. ඒ අවස්ථාවකදී උනත් අපිට කරන්න පුළුවන් දේ තමයි අපිට සමහර විට ඒ ෆියුනරල් එකට යන්න බැරි වුණත් යම් කිසි විදියට අපි ඒ ෆැමිලි එකේ පුද්ගලයෝ එක්ක ඒ නැති වෙච්ච කෙනාගේ ෆැමිලි කණ්ඩායම එක්ක අපි පුළුවන් තරම් ලං වෙලා අපිට ඒගොල්ලන්ට පුළුවන් අපි සපෝට් එක දීලා සාමාන්‍ය විදියට ෆියුනරල් එකක් කරන්න බැරි වුණත් යම් කිසි විදියට ඒගොල්ලන් දානයක් දෙන්න හෝ ඒ පුද්ගලයා වෙනුවෙන් යම් ඒගොල්ලන් යුතුයකම් ටික කරන්න හෝ අපි සහයෝගයක් දෙන්න වෙනවා. එහෙම නැත්නම් ඒ දුක දිගට යන්න පුළුවන්. ඒ පුද්ගලයන්ට ඒකෙන් මිදෙන්න බැරි වෙන්න පුළුවන්.
Thank you, Professor. One more question. Due to the pandemic, do you think the eagerness and the interest to know about mental health and supporting people to enhance mental health has increased?
Well, I suppose there are no studies on this, but I hope so. And I would like that to happen. And I'm glad, I think lots of media coverage and so on is focusing on the whole mental health aspect of this pandemic.
Okay, thanks. Another question. Are there any specific mental health issues that have come up with kids during this period, and how can we address these?
I think with kids, there are so many issues that have cropped up because it's a childhood they are having that's very different from a childhood that we have had, going to school, going to Montessori's, playing around, doing various things, not seeing people around us walking around in masks, and doctors and ambulances rushing around. And even if you were taken to hospital, you are seen by people, masks, and people in various suits, which seem to be from outer space, and not seeing even the doctor's face or the nurse's face, and seeing them behind all these various gadgets they are asking can be very unnerving for children growing up. And I think the profound effect of loss of schooling, as I said, schooling is not about, again, learning of facts, but it's about socializing, of getting to know other kids, tolerance, of appreciation of each one's abilities, understanding your place in this whole big world and finding your way and developing your identity. So all these things are skewed in today's context. Some kids haven't been to school, and various aspects of their development, it has affected them. So it's going to be a generation that's going to grow up having lost out on this, and I'm worried about the effects it will have on their personal development in more than in a physical sense. So I think it's something that we may have to think about, and when children come back to school, we may have to sort of gradually reintroduce them to things and get them sort of to focus on a lot of other aspects, because there could be a lot of school refusal when school children come back to school, a lot of anxiety about many things, about, again, being in classrooms and trying to concentrate and study because so much has been disrupted. And sadly, in Sri Lankan context, we know that although we have had Zoom classes, children in rural schools haven't had any classes. And I'm glad that at least the smaller schools with 200 children are reopening, because many of these kids have not had any educational experience because they haven't had the opportunity to have smartphones or computers or so on to access any knowledge or any teaching. මේ ප්‍රශ්න තමයි ළමයිට කොහොමද මේක ඉෆෙක්ට් වෙලා තියෙන්නේ කියන එක. ළමයිට මම හිතන්නේ මේ හරි අසාමාන්‍ය ලෝකයේ ඒගොල්ලන් ජීවත් වෙන්නේ. අපි පොඩි කාලේ අපි සෙල්ලම් කරා, එළියට ගියා, අපි ආවට හිටපු මිනිස්සු මාස් දාගෙන හිටියේ නෑ. හැමෝම ආදරෙන් අපිව පිළිගත්තා, ඕන ගේකට ගියා, ආවා, අපි හැමදේම කරා. දැන් මේ අවස්ථාව අපිට නැති වෙලා තියෙනවා. ළමයි ගෙවල් ඇතුලේ වැඩි වෙලාව කම්පියුටර් හරි මොන හරි ෆෝන් එක හරි යම් දේවල් කරගෙන ඉන්නවා. සාමාන්‍ය සෙල්ලම් කරන්න අවස්ථාවල් නැහැ, ක්‍රිකට් ගන්න අවස්ථාවල් අඩුයි. ඉතින් ඒ වගේ තුල ඒගොල්ලන්ගේ එකක් ෆිසිකල් හෙල්ත් එක ගොඩක් නෙග්ලෙක්ට් වෙනවා. මේ ෆිසිකල් එක්සර්සයිසස්, ගේම්ස්, ක්‍රීඩාවල් වලින් ඇති වෙන ඒ දියුණුව, ඒගොල්ලන්ගේ ගමන නැති වෙලා තියෙනවා. ඒ වගේම ඉස්කෝලේට ගිහිල්ලා අනිත් ළමයි එක්ක මූ වෙලා එතන ඇති වෙන නායකත්වයේ, එතන ඇති වෙන යම් දියුණුව ඇති වෙලා නැහැ. ඉතින් මේ තුල ගොඩක් අය ඉන්ටර්නෙට් වලට ඇඩික්ට් වෙලා තියෙනවා, ගේම්ස් එහෙම කරනවා. ඒ වගේම සමහර ළමයිට ඉස්කෝල මොනවා හරි ඉගෙන ගන්නවත් අවස්ථාවල් නැති වෙලා තියෙනවා. දුර පළාත්වල ඉන්න ළමයිට ඉන්ටර්නෙට් නැහැ, ඒගොල්ලන්ගේ ගෙවල් වල ටීවී මේ කම්පියුටර් හරි ෆෝන්ස් නැහැ. ඉතින් ඒ වගේ තත්ත්වවලදී සමහර අයට අධ්‍යාපනය පොඩ්ඩක්වත් ලැබිලා නැහැ මේ අවුරුදු දෙකක් සිට. ඉතින් හරිම කනගාටුදායක දේවල් වලට ළමයි මුහුණ දෙන්න වෙලා තියෙනවා.
Thank you very much, Professor. The next is, what advice would you provide, Professor, for many who have lost income and business due to COVID, and what mental attributes would they need to pick up on and rebuild their income source?
Again, that's a very complex.
Yes,
it's going to be a real struggle. It's not an easy answer for people who have lost their incomes. So I think one of the most important thing is, there are so many opportunities, and as a nation, we should enable people to utilize opportunities, and people also need to sort of look positively. And even in the midst of this pandemic, find new avenues to look for. We may have to realign ourselves, realign our minds, be willing to do different things from what we have traditionally done. So again, another thing that Sri Lankan mindset has is that we need to only engage in the things that we've been trained to do. We may have to train ourselves to redo things. In foreign countries, people are very used to this. The engineer may be doing something very different after they qualify. Similarly, even in the Sri Lankan context, we may have to not just stick to the traditional areas that we are used to, but be willing to experiment, to do anything that will and keep ourselves flexibility. I think adapting and being flexibility is the key, again, attribute that is necessary for survival, for human survival. So if you take even a chameleon or any of the birds or any of the animals, they would quickly adapt to an environment. The animal that adapts to the environment survives or has the chance of surviving the most. So similarly, the greatest thing is within us is our ability to be adaptable, to be willing to change our goals, change our aspirations, and try to achieve what we can within the limitations that we have, in the hope that one day we will be able to come out of this and find a better path which may lead us to greater heights. මෙතනින් ආපු එක තමයි යම් කිසි ගොඩක් අය රස්සාවල් නැති වෙලා තියෙනවා, ආර්ථික ප්‍රශ්න ඇතුලේ ඉන්නවා, ඒ වගේම මොකක්ද ඉස්සරහට කරන්න කියලා දන්නේ නැතුව ඉන්නවා. මේවැනි තත්ත්වයේ තුල අපි මොකක්ද කරන්න පුළුවන් කියලා. මේක ලේසි ප්‍රශ්නයක් නෙමෙයි. ඇත්තටම ගොඩක් අමාරු මාර්ගයක්. මම කිව්වේ තමයි මේ අවස්ථාව තුලදී වුණත් ගොඩක් අය අපි වෙනස් වෙන්න, අලුත් දේවල් කරන්න ලෑස්ති වෙලා ඉන්න ඕනේ. අපි යම් කිසි මේ රස්සාව තමයි හැමදාම කරේ, මේ පුහුණුවක් තමයි අපි හැමදාම ලබා ගත්තේ කියලා එතනින්ම අපි හිර වෙලා ඉන්නේ නැතුව අපිට හම්බ වෙන අවස්ථාව බලලා ඒ අවස්ථාවකින් අපි කොහොමද ප්‍රයෝජනයක් ගන්න පුළුවන් කියලා උපරිම උත්සාහයක් දරලා ඒ අලුත් දෙයකට අපි යන්න ලෑස්ති වෙලා ඉන්න ඕනේ. ඒ තුල අපි ඉස්සරහට යන්න පුළුවන් කියන ඒ බලාපොරොත්තුව අපිට හැම වෙලේම තියෙන්න ඕනේ.
Thank you very much, Professor. There are a lot of appreciations that are streaming in the chat, and one kind of summarizes everything when it says, your simple and uncomplicated explanations are greatly appreciated. So that I endorse too, because your explanations are very simple, down to earth, and uncomplicated. So I hope it gives you some impetus to carry on the way you are. So to all of you out there, Professor is about to give us a summary in Tamil, and I do hope all of you all remain to experience Professor's wonderful trilingual skills, which are very important in today's context. So please do stay on and experience his skills of being a trilingual specialist. Over to you, Professor.
Thank you for those kind words. I will just share the screen again and speak in Tamil so that they will also see the slides, if that's okay. வணக்கம். இந்த தினத்திலே நான் தமிழிலே சில வார்த்தைகளை சொல்றேன். இந்த கோவிட் வருத்தத்தின் மத்தியிலே நாங்கள் சில விஷயங்களை மாறி யோசிக்க வேண்டியிருக்கிறது. ஆங்கிலத்திலே நாங்கள் ரெட் ரேஸ் என்று சொல்லுகிற ஒரு காரியம் இருக்கு. அதாவது நாங்கள் எல்லாரும் ஓடிக்கொண்டிருக்கிறோம். ஒரு எலியை பார்த்து மற்ற எலி ஓட தொடங்கின அப்புறம் எங்களுக்கு இதை நிப்பாட்டிலாம் அங்கே ஓடுறோம் மட்டும் தெரியாது, நாங்கள் ஓடிக்கொண்டே இருப்போம். ஆனால் இப்படியான சிந்தத்திலே இந்த கோவிடுக்கு பிற்பாடு நாங்கள் நின்று கொஞ்சம் சில வேளை யோசிக்க வேண்டி வந்திருக்கு. நாங்கள் இங்கே ஓடுறோம், இந்த ஓட்டத்திலே நாங்கள் எல்லா விஷயங்களையும் கண்டுபிடிக்க முடியுமான்னு சொல்லி. கோவிட் காரணமாக நாங்கள் கொஞ்சம் ரிலாக்ஸ் பண்ணுறதுக்கு மியூசிக் அது இது பல விஷயங்களில் எங்களுடைய தோட்டங்களிலே கொஞ்சம் வேலை செய்வதற்கு எங்களுக்கு சந்தர்ப்பம் கிடைச்சிருக்கிறது. ஆனால் அதே நேரத்திலே பலரிடத்திலிருந்து நாங்கள் வேறாகி தூரத்திலே இருக்க எங்களுடைய தனிப்பட்ட முறையிலே வாழ்க்கையை கொண்டு போக எங்களுடைய பல விருப்பங்களை, எங்களுடைய நோக்கங்களை நாங்கள் கைவிட்டு ஒரு எங்கே நாங்கள் போய் சேர்வோம் என்ற ஒரு சுவர் இல்லாத ஒரு நிலையில இருக்க வேண்டி வந்திருக்கிறது. எங்களுக்குடைய சில வேளை கோவிட் வருமோ இல்லையோ, உங்கள் பலருக்கு இந்த நேரத்தில் கோவிட் வந்திருக்கும் இருக்கலாம், சில நித்திரை இல்லாமல் இருக்கிறோம், பலருக்கு டிப்ரெஷன் மற்றது ஆங்ஸைட்டி அல்லது காரணம் மன சோர்வு என்ற நிலை வந்திருக்கிறது. உலகத்திலேயே பலருக்கு இந்த வருத்தங்கள் வந்திருக்கு. அதாவது போன வருஷத்திலேயே டிப்ரெஷன், ஆங்ஸைட்டி போன்ற காரியங்கள் 100க்கு 20 தொடக்கம் 50% கூடியிருக்கு என்று சொல்லி பல நிபுணர்கள் ஸ்டாட்டிஸ்டிக்ஸ் மூலமாக அப்படி உங்களுக்கு காட்டியிருக்கிறார்கள். பலர் தங்களுடைய தொழில்களை விட்டிருக்கிறார்கள். சிலருக்கு வீடுகளிலே பிரச்சனை, அவங்களுடைய புருஷன் மனைவியோட பிள்ளைகளோட ஒரு இடத்துல இருக்கும்போது சண்டை சச்சரவு போன்ற விஷயங்கள் வந்திருக்கிறது. பலர் சாராயத்தையும் வேறு காரியங்களையும் நாடி அவங்களுடைய தனிமையை போக்குவதற்காக முயற்சிக்கிறார்கள். ஆனால் இதன் மத்தியிலே நாங்கள் எந்த நேரத்திலையும் யோசிக்கக்கூடிய வேண்டியதுதான் எங்களுடைய வாழ்க்கைகளை நாங்கள் பலவிதமாக கருதி எங்களுடைய சரீர சுகம் மாத்திரமல்ல, எங்களுடைய மனநிலை, எங்களுடைய ஆத்மீக சுகத்தை எங்களுடைய வேற விதமாக நாங்கள் தேடிக்கொள்ள வேணும். இவையும் எங்கள் வாழ்க்கைக்கு முக்கியம் என்பதை நாங்கள் தெரிந்து கொள்ள முடியும். நாளாந்தம் எங்களுடைய எக்ஸசைஸ் போன்ற விஷயங்களை செய்து சுகமாக நாங்கள் நல்ல சாப்பாடை சாப்பிட்டு மதுபானம், மது போன்றவைகளை நாங்கள் பாவிக்காமல் இருக்க வேண்டும். அதே போன்று வாழ்க்கையிலே நாங்கள் ரிலாக்ஸ் பண்ணி ரெஸ்ட் எடுத்து பல வேறு விதங்கால காரியங்களிலே நாங்கள் ஈடுபட்டு எங்களுடைய குடும்பங்களோடு கூட டைம் ஸ்பெண்ட் பண்ணி சில விஷயத்திலே உலகத்தோட மற்றவர்களோட எப்படி நாங்கள் பிரச்சனைகளுக்கு முகம் கொடுத்து முன் வரலாம் என்றதை யோசிச்சு வாழ வேண்டும் என்பதுதான் நான் இந்த இடத்திலே சொல்லுகிறேன். அப்ப நாங்கள் கேட்ட கேள்விகளிலே கூட உங்கள்கிட்ட கேட்டதுதான் இந்த மாதிரி நாங்கள் இந்த பிரச்சனை கூட எங்களுக்குள்ளே ஒரு 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 எழுப்பை, ஒரு விழிப்பை, ஒரு குரோத், அதாவது நாங்கள் முன்னேறி வரலாம் என்று சொல்லி பல விடங்களில் நாங்கள் யோசிச்சு எங்களுடைய வாழ்க்கையில பிள்ளைகள் எல்லாம் பல பிரச்சனைகளுக்குள்ளாக போயினோம். அவருடைய பாடசாலை கற்றல் போன்ற விஷயங்கள் இந்த நேரத்திலே பாதிக்கப்பட்டிருக்கிறது. இவற்றின் மத்தியிலே நாங்கள் எப்படி சில விஷயங்களுக்கு முகம் கொடுத்து அதே நேரத்தில் பலவிதமான மிஸ்இன்ஃபர்மேஷன், வதந்திகள், வேற கதைகள் எல்லாரும் இந்த சோசியல் மீடியா ஊடாக பரவி கொண்டிருக்கிறது. இவற்றின் மத்தியிலே எப்படி சரியான விஷயங்களை நாங்கள் தேர்ந்து கண்டு பிள்ளைகள் கூட பொதுவாக படிக்க வேண்டிய முக்கியமான விஷயம்தான் எப்படி நாங்கள் சரியான விவரங்களை தேர்ந்தெடுக்கிறது. எங்களுடைய பாடசாலையின் ஊடாக நாங்கள் படிக்க வேண்டியதும் கற்க வேண்டியதும் சரியான காரியங்களை நாங்கள் தெரிவெடுத்து அவற்றை முன்கொண்டு போகிறதற்கு. ஆகவே இந்த பிரச்சனைகள் மத்தியிலே நான் நினைக்கிறேன் நாங்கள் ஒரு நாளையும் ஒரு நாளாக எடுத்து நாங்கள் எங்களுடைய மனநிலையை கூட நாங்கள் நல்ல ஒரு பண்பாடாக வைத்திருந்து அதை நாங்கள் இன்னுமாக உயர் இடத்துக்கு கொண்டு போய் எங்களுடைய ஆத்மீக வளர்ப்போடு எங்களுடைய மனநிலை வளர்ப்பையும் முன்கொண்டு போக வேண்டும் என்பதைத்தான் இந்த நாளிலே நாங்கள் கதைத்தோம். நன்றி.
Thank you, Professor. There is a question in Tamil and I have translated it into English. What is the reason for lack of psychological support in quarantine centers?
That's a good question, I must say. So, I think again
I think you should answer in Tamil.
அது ஒரு நல்ல கேள்வி. அதாவது குவாரண்டைன் சென்டர்ல உண்மையாகவே கொண்டு வந்து அவர்கள் அதன் முக்கியத்துவத்தை அவர்கள் கண்காண இல்லை, அவர் கண்டு கொள்ளவில்லை. அதுதான் முக்கியமான பிரச்சனையா இருக்கிறது. ஆனால் அப்படி இருந்தாலும் அதுக்கு கவுன்சிலிங் செய்யக்கூடிய நபர்கள் அந்த இடங்கள்ல இல்லை. ஆனால் இப்போதைக்கு அதுக்கேற்ற நம்பர்ஸ் சில இருக்கின்றன. அவற்றை அவர்கள் தொடர்பு கொண்டால் அதன் மூலமாக கவுன்சிலிங் பெற்றுக்கொள்ள முடியும். அப்படியான பிரச்சனை இருந்தால் ஈவன் சுமித்ரயோ நம்பரை கால் பண்ணி கதைக்க முடியும். எல்லாவிட்டால் 1938 நம்பரை அவர்கள் கால் பண்ணி அதிலே கூட தமிழிலே அவங்களுடைய பிரச்சனைகளை கதைக்கக்கூடியதான சில சந்தர்ப்பங்கள் உண்டு. ஆனால் நான் நினைக்கிறேன் நீங்கள் கேட்ட மாதிரி இதை விட கவுன்சிலிங் சப்போர்ட் இந்த சென்டர்ஸ்ல இருக்கத்தான் வேணும். அவசரமாக இவை பல இடங்களிலே தொடங்கினபடியால் நான் நினைக்கிறேன் அதுக்கு ஏற்ற ஒரு அடிப்படையை அவர்கள் உருவாக்கவில்லை.
Professor, there is another request for you to answer that in English too.
Okay.
Sorry.
No, I said that's the main reason perhaps being that people didn't realize the need for psychological help in most of these centers, and there were so many that were created, and this was not something that people really thought was necessary. But I think it's an important need, and perhaps there weren't enough people also to be available. But I think it's something that they should really consider. And I think what we did when I was in the college was that we had a hotline number through which we did provide support. And I was telling them that they could even call Sumithrayo or even access the 1938 hotline that NIMH is using if they really want to speak over the phone or something like that. But I think in ideal situations, there should have been a counselor available or psychological support available at every center.
Okay, that's sad that if it was not there, that the health services did not think it was necessary. You know, how it is typical how mental health is neglected all around the world. No? So that is why I think the message today about the inequality is very evident. Another very interesting question, Professor. What advice would you provide to employers who may recruit someone who has changed their profession in managing these people? Probably somebody who has changed their profession but has got to apply for a job just to keep going. And the question is, I think, asking how the employer can be helped to navigate this person.
Right. So I think, I mean, everybody is under pressure, the employers as well as employees in the current context, because employers have to pay their workers, they need to make profits, and it's not easy. So they push the few employees that they have to do their maximum. So I think, first and foremost, I think rather than doing anything, the employer also has to take some time off to de-stress himself or herself and find the right balance. And that's where, you know, not just their psychological, but all there's a spiritual state, in the sense of, you know, calming themselves down and being mindful of the realities, help them have more tolerance and acceptability of the employee and understand their struggle and why they may be coming in, and not just to have preconceived ideas or prejudices as to what that person can do or cannot do, because sometimes they may fit in well and perhaps even do better than someone who is trained to do that job. So it's all about a mindset of being open, both in terms of accepting the employee and giving him the opportunity to excel in what they are doing.
Thanks, Professor. I do hope your message goes out to those such employers around there, who must be many, because people are seeking jobs aside from their professions just to keep their home fires burning, I'm sure. So again, lots of people have been appreciating the manner in which you have answered these questions, Professor. I don't know, you must be getting these kind of accolades wherever you go, but I just want to convey it to you. And as we close, thank you very much, Professor, again, for being so trilingual with us, and also projecting Sumithrayo as a very inclusive organization. We would like to remind our participants of our next two webinars, which we assure you will be as interesting as this one and the one before. And if you or a loved one or a friend has a friend in distress and needs emotional support, please do contact Sumithrayo at the contact details shown in your screen. Remember, this is a free service. Also, Sumithrayo, an ancillary of Sumithrayo is Malmadra, the Sumithrayo Drug Demand Reduction Center. Anybody with an addiction issue, again, another free service, is welcome to call these numbers and obtain our support right through the road to recovery. So a big thank you to all of you who have found the time and stayed on to listen to Professor Williams. Your presence is very inspiring. Thank you to Professor Shehan Williams for finding the time to be on our panel today and for imparting to us his very valuable knowledge and experience. Thank you so very much, Professor Williams. And finally, a very big thank you to all those volunteers at our center who are working tirelessly to make all of these webinars happen. This is no easy task during a lockdown or a pandemic, and Sumithrayo really appreciates all of your inputs. So thank you very much. Again, as we close, Professor, I hope to see you again. Nice
Thank you
meeting you. I
again
know
for
you're
inviting
extremely
me.
busy.
Thank you again for inviting me. It was a pleasure to be part of this panel, and I'm honored to have shared my thoughts with you.
Thank you, Prof. See you again. Take care.